Doctor, what was the impact of your statement locally? It was televised locally. It was also televised nationally last week. And do you have a sense of what you were trying to communicate to people in Iowa got through to people in Iowa?
So you hear a lot when you care for patients, and you really feel for everybody right now because there's so much uncertainty. And so as I'm working with one patient who has a family member who is struggling with the COVID infection and they're in the hospital, then I move on to my next patient who is currently laid off and doesn't understand why this has to happen. So it's either feast or famine for a lot of people. What we noticed is because you always doubt yourself, gosh, is this really helping? Is it making a difference? Is social distancing? And then when all of a sudden we started to see our positives, and we realized it was positive the person works at Tyson's, positive the person works at Tyson's, then you're like, we have a problem, 2,700 people. And our urgent care exploded just within the next, week to 2 weeks. It just exploded with the number of sick people. What was even more profound is when you got those positive test results back, then you started to make the phone calls. So tell me who all lives in your home. Where does this person work? And so you realize it is an underserved population like we're used to treating. And then there's several people that live in the home, 8 to 15 people. So Joe goes to work at Tyson's. He comes home. He's married. He's married to somebody that works in a long-term care facility at our another manufacturing plant. And then that's when the weight of what is going on that you realize, oh my, here it goes. Here goes the spread. And that's exactly what happened. And so our plea is that social distancing is working. And just that one manufacturing plant, I just remember thinking, oh my gosh, this is just one plant. We had people lined up outside. We were trying to do the social distancing, get them in rooms as quick as we can, making them wait in their cars so they stayed away from other people. We didn't want them to go to the pharmacy. We would run medicines out to their cars so they didn't have to walk through our building. But it was explosive and overwhelming. And then again, the phone calls. And I think then to me, the follow-up is here Joe, and I'm using Joe as just a generic name. He goes home. He's trying to provide for his family. He's trying to make a living. And then what happens is he gives it to his parents, who he's been taking care of. And now his elderly parents are in the hospital and they're struggling and not going to make it. And I think that's just the whole where you just feel that pressure and you feel for patients going through that.